So investigations of pancreatitis, chronic pancreatitis. We have labs and we have imaging. So in the labs we have no specific test for chronic pancreatitis. None of the labs are specific to this condition. However, we have other labs like steatorrhea is assessed by measuring fecal fat excretion. The amount of fat in the fecus content of this patient can be measured to assess steatorrhea. And then second, we have Lund test, L-U-N-D, Lund test, secreting and pancreozymin stimulation show reduced pancreatic secretion. So in this test, there is stimulation of secretin and pancreozymin. Once these are stimulated, it shows reduced pancreatic secretion. Then we have glucose tolerance test. The last one is the serum bilirubin and other liver function test. So you can check bilirubin in the serum and also do liver function. And then we have imaging, which is the second part. In that we can do plain X-ray, ultrasound, CT, ERCP, MRCP, endoscopy, ultrasonography. So in plain X-ray may show calcification or stones. X-rays always show stones, right? And then we have ultrasound and CT scan that can detect pancreatic enlargement and show associated biliary pathology. It's always the CT scan that shows whether an organ has increased in size, like enlarged or not. So this is a tip probably. So ERCP, endoscopic retrograde cholangiopancreatography, is of great value in chronic pancreatitis. It should be performed if operation is concerned. So before doing the operation, you have to do ERCP. The architecture of pancreatic duct is revealed in this imaging. So common features include strictures like narrowing, or it will show stone or maybe cyst, or alternating strictures or maybe dilatations of the pancreatic duct can be shown, which give an appearance that is known as chain of lakes. Okay, so this dilatation and strictures look like chain of lakes. So pure pancreatic juice can be obtained for cytology to exclude malignancy. So if you want to make sure and like this patient has no malignancy, you can obtain pure pancreatic juice for cytology procedures. So ERCP is sometimes of therapeutic value as well. How does it do that? Therapeutic means treating, okay? So endoscopic division of the sphincter of OD, which is sphincterotomy, is done in cases of obstruction of the duct, opening with stone, or with stenosis of the duodenal papillae. So how does it treat? It divides the sphincter of OD in the patients who have obstruction of the duct opening with stone. So this patient has a stone that is obstructing the duct, and in that case we can do sphincterotomy by endoscopic division. Or maybe this patient has a stenosis, narrowing of the duodenal papillae. There also we can do sphincterotomy by endoscopic division. Then we can talk about MRCP, magnetic resonance cholangiopancreatography. This provides information on the pancreatic ductal system. So now we need to know about the ducts. Okay, so full system, right? So MRCP is very useful in planning for surgical or endoscopic intervention. So we were talking about ERCP. So MRCP is also useful when it comes to ERCP, doing ERCP. And also before surgery. So all of these MRCP, ERCP, these are done very useful before the surgery. Endoscopic ultrasonography may be the best test for imaging the pancreas. Okay, it may be the best one to show, but it requires a highly skilled gastroenterologist. Why? It's always the gastroenterologist that do the endoscopy, if you have noticed. So they are the one who can do the endoscopy, and they have to be very highly skilled for this imaging of pancreas. The most predictive endoscopic feature is the presence of stones. So presence of stone is the most predictive endosonographic feature. So again, you have to remember that ERCP is not only for imaging purpose, it is also sometimes therapeutic as well. And endoscopic ultrasonography is the best test for imaging the pancreas. And also, there are no labs which are specific for chronic pancreatitis. That's it. These are the investigations of chronic pancreatitis.